everyone, Tyler Angelos here, board certified plastic surgeon at Columbus Aesthetic and Plastic Surgery, here to answer your questions. And the first question we had was, what is the difference between a mini facelift and a full facelift? This is a great question because there's a lot of different variations to facelifts. There's a lot of different techniques that are used, but what they all tend to do is address the extra skin and wrinkles on the cheeks, jowls, and neck. And depending on what technique is used, both the skin and the tissues under the skin are tightened and restored to a more youthful appearance in a natural way. Some people have excess skin that ranges all the way from the cheeks, jowls, down onto the neck and need tightening of all three areas, whereas other people have just a small amount of skin or a small amount of loose tissue on the cheek area. If there's a small amount of loose sagging skin on the cheek area, a mini facelift is generally performed. This is done through a slightly smaller incision than the full facelift and tends to have just a little bit quicker of a recovery time. People with a lot of extra skin, wrinkles, and sagging tissues that need to be restored back to their youthful appearance in all three areas need the full facelift. All right, question number 2. What is the difference between a mini tummy tuck and a full tummy tuck? So regardless of what technique you have, a tummy tuck removes the extra skin and fat from the belly. They're both done through an incision hidden low in the underwear line. A mini tummy tuck removes only the skin and fat from the belly button down. This is common in people who have just a small pouch below their belly button, often after kids or above a C-section scar. A mini tummy tuck does not address the muscles and it does not do anything to contour or remove skin or fat from the upper part of the belly above the belly button. A full tummy tuck is done for people who need help with extra skin both below and above the belly button, as well as tightening of the muscles underneath. Often the six-pack muscles called your rectus muscles get stretched out with pregnancy and they tend to go to the sides. In a full tummy tuck, these muscles are sewn back together, recreating a normal anatomic plane for them, as well as tightening up all the tissues on the inside to provide a longer lasting result. A full tummy tuck is done through a larger incision, still hidden in the underwear line, and generally has about a 6-week recovery until you're back to the gym or back to jogging or working out. Big thanks to all who submitted questions this time. Sorry we couldn't get to all of them, but stay tuned and we'll keep the answers coming.